Next, I have the pleasure of introducing Petja Orre. He's a medical doctor, a specialist in public health medicine, and director of primary care at Mehiläinen. Please.
Thank you, Arne, and nice to see you all here. I think I have a tight schedule, but I try to go through this quite quickly so we can then focus on the panel discussion. Arne already introduced me, but just to make sure everyone knows by the examples we have heard already this morning, this is the revolution of AI is highly technological, but there is also a human side, and that's something I'm going to focus today. So I'm talking about the perspective of healthcare professionals, especially doctors, but this includes all the professionals, of course. And just to give you a bit of a context, Mehiläinen, founded over 100 years ago, is nowadays quite a big player in healthcare, not only in Finland, but also in Northern Europe and Eastern Europe. We do annually over 10 million physical visits, 4 million digital visits, and we employ 50,000 healthcare professionals and other professionals. So this means that everything we do with AI has to be scalable, not only for hundreds or thousands of professionals, but to different countries and to different cultures and to tens of thousands of people. So Johan already introduced the ideas what AI can do and how it can improve healthcare processes, and here is our take on it. There are important already right out of shelf solutions like AI Scribe, for example. Then there is research decision support that we are focusing a lot, quality and accuracy. And then there is the population health management is something I would like to discuss you with today, but I don't think we have enough time for that topic. But the real question isn't what the AI can do. We already heard it can do marvelous things, a lot of things beyond our imagination, but how it will change the professional work we do and how it will affect our healthcare professionals. There is only a few figures to give you an idea. There is a lots of research. We heard from Jarmo that how it differs, how many percent of our professionals have already used AI at some point. And what's even more alarming, that only a very few have gotten any kind of training how to use the AI. That's something, for example, we in Mehiläinen are now focusing, and we are training in the next months, we are training hundreds of our professionals in every unit, in every country, to be AI ambassadors, to give them short but comprehensive training on AI so they can be both the ambassadors and also a local so-called help desk, and we provide them a straight connection to our AI and data science team so they can be their eyes and ears in the field. But still, everyone is asking, even though the LLMs came already a few years ago, that will AI replace doctors? And this is the most common question I got asked, and this is a topic even for seminars, that what will happen to our jobs? And to make everyone feel a little bit relaxed, it's not going to replace doctors. But what we have to do is redesign our professional roles and what we are doing and how our professionals can provide value, what they can do with the time they have after automating easy tasks or using scribes to reduce time used for making notes. So it's not by default that our professionals can and will know how they will spend that time. And if they don't understand and if they don't get the idea that what they should do with the time they have, it might lead them to feel if not meaningless, but a little bit numb, because we have used, all healthcare professionals have used years in training, then years in the field of work to gain expertise and to have ways of doing the clinical judgment. And especially with the doctors, as you know, the autonomy is really important part. And now at least some of the clinical support systems or diagnostic helpers or assistants might lead you to feel that you are not in charge anymore. And how can you argue with the AI? Or how can you explain to your superiors or to your colleagues that you are not trusting this computer? You don't want to use it, and you are suspecting that there is something missing from the results you get or from the suggestions you get. So resistance is sometimes it's good, especially in the high stakes area like healthcare, because it's always so that we all have been trained to be risk aversive. That's by default in healthcare profession. And we always have to weigh the gains and the losses. And what this means for AI implementation is it's not saying, and I don't want to say that we shouldn't use AI tools. It means that those who develop it, those who are about to implement it, should be aware that not all the resistance is bad, or it's not everything. Everything is not about they being like old and stubborn doctors who don't want to change, but they are really and sincerely worried about the safety. And one of the issues, we always talk about the black box or not understanding how the AI works. But there is also a very important thing is that we actually don't understand what kind of mistakes AI can make. We already know that when we are in emergency room, when we are tired, when there are a lot of patients, we know that what kind of mistakes we are prone to do in that sense, but we don't understand what kind of mistakes that AI might do. So we are worried that we are going to miss some of the cases, or don't point out the mistakes because we don't understand how it works. So what we have to do is, in every AI tool, we have to build it with clinicians, we have to prove it with clinicians, and then when we scale it up, we need to use healthcare professionals for the scaling up. And it's still not very common understanding in AI tool implementations. It's all quite often top down, that now there is a new tool, there is 30 minutes of training, and now use it. So what we have to do, and what you have to do if you are in the business of implementing or producing AI tools, is to make it feel as safe choice as the previous one. And then you have to understand, and we all have to understand, that it's going to be a little rough. There is going to be discomfort. Like in every change, there is going to be discomfort, and we must not be turned down by the negative aspects, negative comments on it. It will take time, and this is something we have told also to our clinicians, our professionals, that this is going to hurt a little bit before it makes things better. It's like injecting a drug in many cases. So first it hurts, and then it helps. So there is a very short introduction about our case. AI scribe or tekoälykirjuri, as Johan mentioned in Finnish. But the most important thing is that from the early stages, we took our professionals in multidisciplinary teams to be part of it, to test it, to report how it works, and to focus on the workflow especially, in which cases and how we should use this. So, how we can make AI meaningful for healthcare? The first and most important thing is that you have to know, when you are bringing an AI tool, you have to know how the work is done, what the workflows are. Otherwise, the implementation might be really, really hard. Of course, engaging early adopters, it's a basic thing. And then one thing, our professionals are under a burden of heavy workload in every workplace. So there is only a very limited number of professionals who want to be pilot testers or beta phase testers. So we have to deploy ready, and I don't mean super ready, but ready enough products when we want to scale it up. Otherwise, people won't use it. We found out that with our AI scribe that it was good, but it wasn't good enough. So doctors weren't using it because it took more time actually to solve the problems than just to make it the old-fashioned way. And the most important thing is that we have to redefine the value, as I mentioned earlier. We have to train, we have to discuss, and we have to find ways to explain how our professionals should use their time, what extra value they can bring by using the AI tools. Otherwise, there is going to be resistance years and years from now. And there is going to be a problem with feeling meaningless, feeling numb, feeling just a button pusher. And that's something that won't help us implementing the tools. Thank you.